Imagine suddenly feeling a knife-like pain in your upper belly, so severe that you can't even lie still. And it spreads straight through to your back. That's how acute pancreatitis often strikes, without any warning.
Hi, I'm Dr. Naeem, and in today's video, we're going to talk about a condition called acute pancreatitis. We'll cover what it is, why it happens, its symptoms, how it is treated, and what to expect during recovery.
Just to say up front, this is an educational video only. If you're experiencing abdominal pain or any of the symptoms we cover here, you should speak with your own healthcare provider. What is acute pancreatitis? So let's begin with the basics. Acute pancreatitis is a condition where the pancreas becomes inflamed very suddenly. The pancreas is an organ located in the upper abdomen, behind your stomach. It helps digest food by producing enzymes, and it also regulates your blood sugar by producing insulin. In pancreatitis, those digestive enzymes activate too early, inside the pancreas rather than in the gut. This leads to inflammation, and in some cases, it can cause damage to the pancreas or nearby tissues. Now, when we say acute, we mean it comes on quickly, over hours to days. In most cases, it settles with treatment and leaves no lasting damage. But in some people, it can be very serious and even life-threatening. How common is it? Next, let's talk about how common it is. In the UK, 13 to 45 people per 100,000 develop acute pancreatitis each year. It's become more common in recent years, partly due to rising rates of obesity. Symptoms of acute pancreatitis. So, what are the main symptoms to look out for? The classic symptom is abdominal pain, usually just below the ribs. This pain can be sudden and severe, or it might start off mild and worsen over time. It often spreads to the back and can last for several days. It may feel worse after eating. Other common symptoms include nausea and vomiting, a high temperature or fever, a swollen or tender abdomen, feeling generally very unwell. In more serious cases, if the inflammation spreads to other organs, you might develop low blood pressure, dehydration, or even organ failure involving the lungs, kidneys, or heart. Some people, particularly those with diabetes or kidney disease, may have pancreatitis with little or no pain. What causes it? Let's now explore the common causes of acute pancreatitis. Over 80% of cases are caused by either gallstones or alcohol. Gallstones are the most common cause. These are small stones that form in the gallbladder and can block the bile duct. If one gets stuck where the bile duct meets the pancreas, it can trigger inflammation. Alcohol is the next major cause. It doesn't directly damage the pancreas, but it makes the pancreas more vulnerable to damage from other things, like fat in the blood or infections. Other, less common causes include very high blood fat levels, called hypertriglyceridemia, certain viral infections like mumps or HIV side effects from some medications, injury or surgery around the pancreas, high blood calcium levels, autoimmune disease, where the body mistakenly attacks the pancreas, a hereditary form that runs in families. Sometimes, no clear cause is found. This is called idiopathic pancreatitis, and it happens in about 1 in 10 cases. What happens during an attack? So what exactly is going on during an episode of acute pancreatitis? Normally, the digestive enzymes your pancreas makes are inactive until they reach your intestines. But in pancreatitis, these enzymes activate too early and start digesting the pancreas itself. This causes inflammation and a cascade of chemical reactions. Most cases, about 4 in 5, are mild, and people start to feel better within a week. But in around 1 in 5 people, the inflammation becomes severe and leads to complications like tissue death, necrosis, or inflammation that spreads throughout the body. That's when people can go into shock or organ failure, which can be fatal. Diagnosis and tests. If a doctor suspects pancreatitis, you'll usually be admitted to hospital for tests. These might include blood tests to measure amylase and lipase, enzymes that rise during pancreatitis, an ultrasound to check for gallstones, a CT scan if more detail is needed, or if the diagnosis is unclear. Because other conditions can cause similar symptoms, it's important to rule those out. Treatment for acute pancreatitis. Let's move on to treatment now. There isn't a medication that cures pancreatitis directly. Instead, the focus is on supportive care while the inflammation settles. This often includes strong painkillers, often given by injection, a nasogastric tube, to drain stomach fluid, or give nutrition if eating isn't possible. IV fluids, given through a drip to prevent dehydration. A catheter, to monitor urine output, which can help assess kidney function. If complications develop, additional treatments may include admission to an intensive care unit for close monitoring, a procedure to remove a blocked gallstone, antibiotics if infection occurs, surgery to remove damaged or infected tissue. Most people recover fully, but it can take time. When to see a doctor. You should seek urgent medical help if you develop new or severe abdominal pain that doesn't go away, especially if it's associated with vomiting, fever, or feeling faint. Preventing future attacks. For some people, pancreatitis is a one-off event, but if the underlying cause isn't addressed, it can happen again. To prevent future episodes, if gallstones were the cause, your doctor may recommend gallbladder removal surgery. If high blood fats were the issue, medications and diet changes can help. If a medication triggered it, your doctor may switch your prescription. And when it comes to alcohol, you should avoid alcohol completely for several months after an episode. If alcohol caused the pancreatitis, it should be stopped entirely and permanently. If you're struggling with alcohol dependence, support and counseling can really help outlook and prognosis. The outlook depends on how severe the attack is. In about 4 out of 5 people, it's mild, and people recover fully with no long-term effects. But in severe cases, which affect 1 in 5, it can be life-threatening. Even with intensive care, about 1 in 4 people with severe pancreatitis may die from complications. So, in summary, acute pancreatitis is a sudden inflammation of the pancreas. It's often caused by gallstones or alcohol and ranges from mild discomfort to a medical emergency. Most people recover well, but it's important to treat it seriously and address any underlying causes. As always, if you have new or persistent abdominal pain, don't ignore it. Speak to a doctor.
Thanks for watching. If you found this video helpful, like, share, and subscribe to Dr. Naeem for more reliable medical information. Take care and stay worried.